We're here to round out the discussion on health equity and to talk about a term that we like to think about and focus our behavior on, which is health information equity. So we think about the information, the data, whether it's clinical trials or other research. We generate a lot of data, and in our traditional model, and the model that Catherine and I came up through, so much data focused on the professional audience. So much of my background and Catherine's background has been, clinical trial management, clinical trial data, and getting that information through publication and presentation to scientists and healthcare professionals. And what we want to talk about a little bit today, and we don't have any slides, is how we've been thinking and acting a lot differently when it comes to that information, because we realize there is hunger amongst non-HCP audiences, specifically patients, caregivers, and others, for information about their disease, their condition, their treatment. And so we think about democratization of that information for audiences beyond the specialist and beyond the HCP. So, Catherine, over to you.
Great, thank you, JR. And I think our the preceding presenters covered a lot of what we will touch on. So, and this will be our spin on what we're doing at Pfizer. So thank you. So we'd like to start by setting the stage, talking about Pfizer and how. And JR's going to answer this question: how does Pfizer define health information equity, and why do we think it's important?
So, with health information equity, I think, it's a good place to start. Let's start from the very beginning, as they said in The Sound of Music. And we want to start with health literacy principles. So health literacy principles, this is not Pfizer's definition. This is the NIH and others defined health literacy. So it's really, I always come back to this, which is the information that we're disseminating, is it accessible? Is it understandable? And is it actionable? And those are the pillars of what we think about when we're thinking about any audience and any information. Is it accessible? Is it understandable? And is it actionable? So can the person take action with that information? Simple, but not easy, especially the sometimes accessibility. And I think Catherine's going to talk about accessibility in a little bit.
Yeah, great. Thank you. So thanks for, setting the stage on that. So what we'd like to turn to now is talking about some ways in which we're doing that at Pfizer in addressing health information equity. And I think what we'll talk about is a little bit around, what we're doing for patients, what is our strategy around that work, as well as, because this is the HITLAB, we'll talk a little bit about some of the technology that we're using to employ those strategies. So,
well, when I think about patients and so some of the things we're doing, I first think about patients as receivers or readers or the destination for that information. But we also think about patients as co-creators with us. So they are authors. And I'm not going to steal Catherine's thunder, because she's done a lot of work with setting policy and practice around patients as authors at Pfizer, which is something that is very innovative. A lot of the work that I've done is thinking about patients as readers or receivers of information. And so a lot of the work that I've done is in plain language. So plain language summaries of publications and plain language summaries of our basic results. So when we produce a CSR, a clinical study report, and a basic results document, which goes on clinicaltrials.gov, those are technical documents. They're lengthy and the language is technical. And what we've learned through research and really anecdotally, non-HCPs, so that's patients, but it's also many other audiences, are looking for information in ways that are accessible, understandable, and actionable. And so translating those materials, so a peer-reviewed publication or an abstract at a conference translated into plain language that is accessible, understandable, and actionable has been something we've been focusing on for the past 4 or 5 years. We're doing that now regularly with our publications. So those are journal publications and abstract presentations at conferences, as well as our plain language study results summaries. We call them PLSRS. And those are now available. There are more than 200, I think there are more than 250 on Pfizer.com/PLSRS. We produce those whether a trial is quote unquote successful or not. So if it's met its primary endpoint or it has not met its primary endpoint, whether it's a program that continues or does not continue, we produce those PLSRS as part of the promise that we make to the participants. But Catherine, maybe you could talk a little bit about the work you've done with patients as authors.
Yeah, absolutely. So, I mean, as you can imagine, our trials are with patients, and we really feel like the peer review process is a way to create trusted information because it's not just coming from Pfizer or the sponsor, it's being peer reviewed by our peers so that we can incorporate other comments into those publications before they're hit the public domain. But we really started thinking about, we should be involving patients in these publications and hearing their voice about their experience. And so a couple of years ago, we created what we call our collaborative board with patient advocates who helped us shape our policies and procedures at Pfizer to incorporate the patient voice in those publications. And so, as J.R mentioned, it's really about, bringing the language to a level which they understand. So it's not corporate speak. It's not using legalese in our in the work that we do. We're very high scientific language. So even the contracts that we have with our patient authors that we work with have been now written in plain language. We have a lot of resources in teaching and training patients on how to be authors of peer-reviewed publications. So we have a plethora of information and resources in order to make that happen. I think we're one of the first companies that has done that. We have, as of this year, worked with, at least in our space, about 41 patient authors, which may not seem like a lot in the grand scheme of the number of publications that we do, but it is, higher than most companies that we know in our space, in our field. So,
And I mean, establishing a policy and changing a contract at Pfizer, oh my God, that's a full-time job by itself. But to institute a policy, you said there are 41. I would say the hardest was the first. To initiate something new and to make sure that it goes beyond a pilot is a huge thing. But Catherine, you reminded us about why we're here, which is technology, and we would be remiss if we didn't touch briefly on some of our technology. And I know you're going to talk about Clear AI, but I'd like to, if I can, just talk about Clear AI for a second, and maybe you could tell us about QRDB and PicShare.
sure.
Clear AI is a tool that used to be a paper checklist for health literacy. So it was developed by Pfizer medical colleagues in conjunction with researchers from Northwestern University. And it was literally a checklist on paper. And then it became an electronic tool. And it is now an AI, not generative AI, but good old-fashioned AI. It's an AI-powered spell checker, if you will, but it's a health literacy checker. And it was developed and launched in July of 2022. And I wrote down a couple stats just to remind myself that in the ensuing 2 years in its use, we've had more than 1,000, so 1,170 users at Pfizer who have used this tool. It's called Clear AI, who have put through 2,500 documents. And the result has been more than 600,000 deviations, meaning Clear AI is identifying words that are too long, sentences that are too long, sentences that are using jargon or technical information, and it flags and marks up those documents and sends them back to the originator. So that's one of the pieces of technology that we've found to be very useful, and it's really cut back on review time by our teams.
Yeah, so the other piece is, we'll touch on accessibility. I could talk about open access all day, but it's really about making the information accessible to the public, to patients. And so, as far as technology, there are a couple of ways that we do that. One is if you go to a congress, and we have poster presentations similar to what you're seeing around here, we have our QR code database, which has both the poster as well as a QR code to the abstract plain language summary. So we have rewritten the poster in plain language for, as abstracts for Congress attendees, which now more patients are starting to attend. The other technology is our Figshare platform. Figshare is a service provided by, or solution provided by Digital Science. And we have now created a repository. We have several use cases, but one most relevant to this conversation is around manuscript plain language summaries, because not all peer-reviewed journals publish manuscript plain language summaries. But we decided that this is something we want to pursue whether or not they publish them. And so we do get permission from the journal, but we now have a repository where patients, actually anybody in the public domain, can access the manuscript plain language summary. So those are two areas of which we've created.
All right, so I know we have about 5 minutes left, but I would be remiss because somebody already asked us before the presentation about this program that I'm super proud of, and I want to just mention. It's called the Participant Data Return Initiative. So the Participant Data Return Initiative was born out of that plain language study results summary, where at the end of a study, patients ask, well, what happened? I participated in your trial. You sent me a little thank you note, and then I never heard from anybody ever since. And we realized that we were not doing a very good job of inviting participants in and thanking them after their participation was over, and then informing them of what happened. And so we first rolled out a program called the Gratitude Program, which was to invite participants and then to thank participants because that's good manners. But we also realized that we were not properly informing those participants. So the plain language study results summaries were born, which reported back the aggregate results. But then there was a different opportunity for us, which was to provide back the patient or the participant's own data. This is something that every participant has a right to. Not every participant realizes that. Not every participant asks for it. But it's something that we feel is fulfilling our social contract with those who have partnered with us on a clinical trial. And so we've now at scale launched through an existing website, PfizerClinicalTrialAlumni.com, the Participant Data Return Program, where participants can come in and request their own data, their labs, their data from their time on the study, to then take, download, and bring to their treating physician for further action. So again, making it accessible, understandable, and actionable. So employing those principles again for the participant data return. This is a program that launched last year in 2023 with 2 trials. It's now at scale for all of our trials in the US. And in 2025, we'll be rolling it out outside the US, which we're very excited about in Europe.
Great, thank you. So I think we'll quickly talk about some barriers that still exist, and then we can move on and wrap it up. So do you want to touch on some of those barriers that that still persist that we are battling?
Yeah, I mean, in terms of publications, there's so many journals and so many publishers. So the traditional publications model, subscription-based model, publications that are not available, open access. This is a barrier to information. So we're always encouraging our teams and authors to publish in open access to remove that barrier to the information. Meeting patients where they are, meeting participants where they are. Again, that accessible. That first step of accessible and then understandable and actionable, we first have to make sure that we're reaching participants or reaching patients and audiences where they are. Catherine is the expert on PLS discoverability. I don't know if you want to speak about that.
Well, I think that's part of that's one barrier is like, we're not it's not meant to be promotional, it's meant to be scientific. And so really, we're not out there pushing our content, but just, making sure that we have the right metadata tags so that as, the public's out there doing their Google searches that they can find that information. So that is definitely a barrier that we're working on and trying to standardize how we tag our information so it can be found. But I think, you touched on reaching the patient where they are, which is our last question and part of the conversation is what's the future in the work we're doing. So I'll talk about EPI a little bit and then we can, so now we're going to talk about the innovative part for HITLAB is that one of the things that we're working on with our labeling team is the electronic product information, or that little piece of paper you get with your medicines when you get your prescription filled. Is we're looking at electronic versions of those and including a link to the plain language summary, because as you know, many undereducated patients who receive their medication may not be able to read that EPI because it's all technical scientific language. So we produce all of these plain language summaries. We should be linking that in that EPI, the electronic product information, so that they have that and putting it right at their fingertips so they actually understand what their medication is about. So that's something that we're working on. We're at the infancy stages of that and trying to get more support across our peers in order to make that something viable in the future.
It's an incredible project in a very regulated area. So it's progress is slow but steady. And finally, with the Clear AI tool that I mentioned before, which is our health literacy checker. So the documents go through and it gets checked. In terms of what's on our roadmap, what are we working on, what's the future? We're really excited that we're now not only checking documents in English and producing those corrections in English, but we're now up to 10 languages. So those documents that are generated in Arabic, Chinese, French, Spanish, Korean, Japanese, German, Portuguese, and lots more on the roadmap. The tool is now able to read and mark up and provide recommendations for documents in these many other languages. So again, accessibility, understandability, and actionability. We can't be actionable and understandable if we're not first accessible. So again, lots more to do, lots more to work, lot more work on the roadmap. But so far, we're very excited about all of the advances that we've made.